Good morning.
Give me a clue. That's what I don't understand.
I wish it weren't April Fool's Day because this is no joke. I'm Elaine Alquist, state senator, your state senator, representing almost 1 million people in Santa Clara County. And it's a pleasure seeing all of you here today. I wish we had better news to talk about, but since you are the leaders in Santa Clara County and beyond, I felt it was really important for you to have an understanding of, and I'm sure many of you have a very good understanding, but even a better understanding as this progresses with the state budget. I'd like to digress just for a moment to say, because I know some of you have questions probably about what I do in Sacramento these days. I no longer chair the Health Committee. I am still on it, and I still also chair the Subcommittee on Aging and Long-Term Care. I'm still on Education. Still on Health Committee. The new position that I have, the Pro Tem Darrell Steinberg, actually last December asked me if I would be willing to give up chairing health to be on Rules Committee with him, which he believes is the most important committee in the legislature. And there are 3 appointed Dems and 2 appointed Republicans. And in that position, we review and confirm all of the governor's appointments. We also keep the trains running on track in the sense that we approve what bills will go to which committees. We are also responsible at a high level for personnel issues, ethics issues, and also safety issues as they affect the state capitol and the members. So I was pleased to be, as he calls me, his wingman. So as a 66-year-old senior woman here, I'm a wingman, and I have found the position most interesting. Before I get into some comments I'd like to make, I'd really like to thank Bill Lockyer and Diana Dooley, and I will be introducing you formally in a few minutes, but thank you so much for being here. And I want to thank all of you, because I know our community well enough to understand that you probably have 20 other places you could be today. So thank you for attending. I'd like to I can't mention everybody because you really came here to learn more about the budget situation, but I would like to just mention a few people who are here. First of all, I'd really like to thank George Blumenthal, UC Santa Cruz Chancellor, Chuck Weiss, County Superintendent of Education, Liz Niss, Santa Clara County Supervisor, Kevin Moore, Santa Clara City Council Member, Kathleen King, Saratoga City Council Member, and we have various community college representatives and school board members. If you could please stand. Thank you very much. I believe, having started out on a school board in 1983, I believe being on a school board is the cutting edge of democracy, because you can't go anywhere, grocery store, bookstore, anywhere, without having somebody, a parent, and I'm a yaya now, I'm a parent and a yaya being a Greek grandmother, without somebody coming up to you and wanting things to be better for their child, and with good reason, because our children all deserve the very best. So I'd like first to give you my perspective of what's gone on for the last 6, 12, 18 months. I say this as one who majored in mathematics and who is also a former financial analyst at Stanford University. Over the past 3 years, because of numerous things, the economy declining, because of term limits, because of initiatives run amok, California has become a very tough state, dysfunctional state to govern. That doesn't speak to the wonderful people who are in it, but to the structure we have created. We have cut over $80 billion in the last 3 years. I could give the other figure, $106 billion, but there's a little part of that that's smoke and mirrors, and you don't want to hear that. You really want to know the real cuts, the real numbers. So it has been devastating. I mean, other than the Great Depression, this is the most significant financial situation we have met over the years. So you may recall that, it might have been in February, I did a piece, editorial in the Mercury News, and I strongly said, we have this huge deficit. The public really needs to have the opportunity to vote and decide on what direction, what path the state will take. And about the same point in time, I decided with my wonderful staff, and I'd like to mention John Heliso, District Director, and Carol Ong, and the famous Lisandro Carrasco and Arkady Kolchak, who are here with us today from my district office, who are always here to help you. When I wrote that piece, I really thought there was a great chance that, not a great chance, a fair chance, that we could get enough Republican support for the budget to put an initiative on the ballot. And to digress a second on that, I need to say that both in my caucus and I think in the entire legislature, I probably was the first one to say the public is smart and they need to understand, you need to understand the total deficit, not just half of it, but the total deficit. And I'll use two terms interchangeably. $27.5 billion is if you include a reserve we need to have, and if you don't include the reserve, it would be $26.5 billion. But I mean kind of the same thing when I use those two terms. So we Democrats were able to come up with $14 billion in cuts. In real cuts, it was probably about $12 billion. And what we believed was that with having to take $1.7 billion from redevelopment, because a lot of those dollars belong in our schools, that's a fact, and that's been the case for many, many, many years. We believed that we could put an initiative on the ballot if we could get Republican support. And a Republican support to do the remaining to get to the 27.5, we could do it with a 5-year tax extension. Not new taxes, but a continuance of the tax level from 2010, taxes that we've already paid. A complicating factor is that to do anything in terms of taxes, you need a 2/3 vote in the legislature, which means in the Senate, we need 2 Republicans. And you also need Republicans in the Assembly. So there are not enough of the majority party, and I know here we have people who are Democrats, Republicans, and independents, but this is just really a fact of the way we have structured government. So most interestingly, on top of needing a 2/3 vote to put the initiative on the ballot, and that way we could have come up with, doing the taxes for the 5 years extension. What complicated it also was that an initiative passed last year that said the majority party could pass a budget with a simple majority, but that you could not raise taxes. And I think I was one of the few Democrats who was not supportive of that because I understood we could get in a situation exactly like the situation we are in today, where the economy was so bad that you could not, if you couldn't increase revenues and you didn't have enough money coming in, what were you going to do? So that's where we are today. So the focus of this meeting today has changed from, yeah, we think, let's talk about the possibility of, having solved half the problem and the other half we're going to deal with possibly putting it on the ballot, to being in a situation here today where we didn't get the Republican support. We've probably, Mr. Lockyer can speak to this, Treasurer Lockyer, but we've probably missed the deadline on the June initiative ballot, and I don't really like the idea of the November ballot, which I was the first to say in my caucus, because it's a gamble. There's no guarantee it will qualify in November. There's no guarantee it would pass in November. And at that point, they would be called new taxes because these taxes expire in June. So they would be new taxes that would be on the ballot, not continuing taxes, if you follow that. So what does that leave? It leaves the worst of the worst. It leaves us with dealing with the consequences of an all-cuts budget. It's an awful picture, and of all my years, I was elected to the Assembly in '96. I was elected to the Senate in 2004. I will be termed out of office December 2012. And it is a most difficult situation. So in a nutshell, that's really what I wanted to say. And have here today two wonderful people, and I'd like to talk about them a little bit. First, I'd like to introduce our treasurer, Bill Lockyer, whom I have known for many, many years, probably from the time I was engaged to Al Alquist, which was a long time ago. And Bill has been president of the Senate. He was an assemblyman. He's our attorney general, and he is most knowledgeable about the situation, and I know that he will just give it to us just as it really is. So we will all walk away with a wonderful grasp on what we will be dealing with. Also really pleased to welcome our California Health and Human Services Secretary, Diana Dooley. I had the great pleasure of working with Diana when I chaired Health Committee, got the opportunity to know her then. Not only is she the Secretary of Health and Human Services, a most difficult area, currently for Governor Jerry Brown, but she served with Governor Brown during his first term as his legislative secretary. And most recently, she was CEO of the California Children's Hospital Association. So I really want to welcome you both, and to take for you to take time, that you have taken time out of your very busy schedule to be here with us. The Treasurer and Secretary Dooley will talk to us for about 70 minutes on the impacts of current and possible future cuts to the state budget, realignment of the state and local relationship, and of course their focus has changed as our budget situation has changed. As we've not been able to get any Republican support for the budget, and as we seem to be certainly headed in the direction of an all-cuts budget, this will be a very tough discussion. So with that, Bill, if you could please start, we would appreciate it.
Thanks so much, Senator, and delighted to be with you, and thank you for convening local leaders to share information. It's how government works best, and I had the honor of working with that other Alquist guy and saw term limits unwisely push someone out the door, and I'm sorry to see potentially another Alquist that the same thing occurs with. And much frankly of our current difficulties are the political consequences of term limits, and it's something that I don't know if people realize that might happen when some voted for it, but anyhow, I digress. We've had this enormously bad downturn. I think the best way to talk to you about it as your banker is to just show you the slides. And I'm going to try to do it sitting if that's okay, and if it doesn't seem, I value the eye contact. If it seems to drift that way, we'll change it. Now, what am I going to point this at? To
Over there.
where is the gadget?
It's over there, Bill.
Okay. All right. It's somewhere there. First, where revenues come from. California is a little different than the national average because we rely more on personal income taxes. The national average is about 37%. Other states, their principal revenue source is sales taxes. In California, we have a narrower sales tax base, though a high rate, compared to most other states, because we don't tax groceries and lots of other things. And so it does push us this way. That creates some political debate about the over-reliance on personal income taxes, and especially the 1% or so at the top, 150,000 people or income tax filers who pay almost 40% of that pot of money. I note in Chronicle today, for those that might have seen this poll from teachers who recommend increasing that particular pot to address our current budget problem by taxing the wealthy. And of course, I did tax work for 25 years in the legislature, and one of the things we often say is the rule is don't tax you, don't tax me, tax the guy behind the tree, meaning the wealthy or someone else that's not you to pay the tax. Now, our problem is, and this comes up especially in the debate over capital gains, and if people want to get into that discussion, I'm happy to. I would rather bank the up years rather than lower the rate and burden middle and lower income taxpayers with higher rates to lower those. But where it comes up is if you increase this rate substantially, many of these extraordinarily wealthy Californians might decide to live in one of their other houses. And that's a problem we have to be very careful about, because the revenue losses get to be substantial if any serious number do that. So that's where the money comes from currently. Maybe I'm going to have to ask someone to do this if it's not going to respond to me trying to do it. You want to try? Did it go? No. Oh, yeah, okay. Well, where does the money get spent? Maybe you do. Sure. The largest single piece of the money, of course, is K-12 expenditures. If you add in community college spending, then that becomes the Prop 98 fund that's even larger. Health being the next biggest piece, human services. In many of these health and welfare spending, which I assume Deanna will address, we get federal matching funds for the programs, and it's one of the ways we get some of the money back from Washington that we send to Washington. And one of the sort of imprudent worries is when we cut the state spending here, we leave more money in Washington, D.C. that otherwise would be available. Corrections, and then a variety of other spending. Now, I should mention, because it's one of the debates we regularly hear, well, gee, government is too big, Sacramento's too bloated, et cetera, et cetera. I don't know how you define these things, but what we do frequently do is compare to other states. California as a state, what we spend per capita on state employees ranks us 44th of the 50 states. That is, we're 6th lowest. Yeah, I think we were 4th lowest just a couple of years ago. It's a little unclear. These layoffs and so on are so frequent all around the country. It's hard to keep track of whether you're 4th, 5th, or 6th, but you get the idea that those red states that we see all over the country are spending a whole lot more of their state taxes on state employees than we are in California. The next one, please. Then another way of understanding the state budget expenditure is to realize that almost 3/4 of the money is transfers to local agencies. One of the schools, cities, counties, and so on. One of the interesting political disconnects is if you ask voters what proportion of your state tax dollar do you think is wasted, they will say things like 48%. Not realizing that most of the state tax dollars go to local agencies with whom they generally have more confidence in their accessibility and essentialness of those spending locally. But anyhow, here's where the money goes, and the biggest state operations, of course, is that piece I was talking about compared to others, UC and CSU debt service, which has grown substantially in the last decade or so as we've tried to catch up and pay for infrastructure projects like schools, transit systems, and so on. I might mention here also, in terms of the budget solutions that's not in the charts, almost everything that the legislature has done so far, there'll be a lawsuit to try to prevent it, slow it down, change it, stop it. The only thing that the governor can probably do without a lawsuit is to totally eliminate the 5.3% of the budget that's devoted to the university and state college system. Now, I don't recommend that. I think it's an enormously unwise thing to do. But it's the only thing the governor can actually probably really do. Dreadful. Please keep going. He doesn't want to, but okay. With our economic downturn, every major tax source got hit. So personal income sales, corporate taxes, they're all down 25 to 30% during this downturn. The budget estimate, the forecast pre-recession, was that the budget now would be about $123 billion, the normal just growth line of expenditures, inflation and so on. Well, instead of 123, we're talking about 83 billion. So you can see the gap between what was anticipated for revenues being available and what actually, in fact, may be available if somebody can figure out the 26 billion that we're talking about that's still part of that 83. Next slide. The best way to understand, at least briefly, how we got here, and some is that economic downturn, of course. California is home to about 40% of all the home foreclosures the entire country. So we had a particularly hard hit on home ownership, on property values, on the retail industries and construction industry and so on that's associated with that. But there were a bunch of imprudent things done, and what happened during the years that it took a 2/3 vote to adopt a state budget. California, like Arkansas and Rhode Island, were the 3 states that required a 2/3 vote to do that. Whenever these stalemates would occur in the summer every year, expediency trumped prudence. And so various gimmicks were used. There's a bunch of them listed that were kind of one-time things or things that were planned or proposed that didn't actually happen, like selling the state compensation insurance fund or selling some buildings or selling the ed fund, as well as other things that were, my favorite of all the gimmicks, of course, is pay the June 30th payroll on July 1st so you can claim the year is balanced. You get to do that one time, basically. But that was done, and other things. So keep going with the charts. This is just a way of summarizing those things that were done, dollars amount associated with them, that were either a one-time thing, counting on federal subsidy expenditures or selling a building or whatever. So 75 to 85% of those solutions didn't work to solve the continuing structural deficit. And I should say, you know this, you read it in the paper, and you're the folks that follow these things. But I do this partly to provide a little more context and detail than maybe you've seen recently. But so, pretty bad batting average when 85% of the swings don't even get close to the ball. Keep going. Here's some numbers associated with those. More detail than you want, but we've got all of this on websites available to anyone that might want to use or share any of the specifics, but the temporary things like federal stimulus, the things that can't be repeated like accelerating collection of income taxes, and the things, a variety of them, that actually made the hole deeper, borrowing from local government and selling tobacco settlement money for 20 years ahead, and things of that sort. Please, next one. Here's the budget deficit looking out a few years. It doesn't go away. Those that still believe in the tooth fairy think that, well, let's just keep looking under the pillow. It'll somehow be okay. We're going to grow our way out of this problem. And there's no one that believes that's what's possible. And so if we're going to address this, it's just got to get done. There's only two ways to do it: cut expenditures or raise some revenues. Hopefully, to the extent you can figure out how to provide existing services more efficiently, that's a good idea and it's part of the plan. But that's obviously not something you do in the height of negotiations that have to be done relatively quickly. Please. So operating surplus with the governor's proposed budget, this is if it were actually adopted in the way he suggested. There have already been a number of budget holes that have arisen. That is, the inability to move the redevelopment money, the inability to get Republicans to support the change in the sales tax factor for corporations in California, and abolishment of enterprise zones. Though there's multiple billions that aren't on this chart yet, but this is how the budget was proposed. Of course, some people saw that, gee, next year, not this, but the subsequent fiscal year, there could actually be a couple of $1 billion surplus. That got spent about 10 different ways as soon as anyone saw the chart. But anyhow, the governor's proposal was, at least, let's have a balanced budget for the reasonably foreseeable future. Keeps the promise of honest budgeting, get it balanced, get rid of this structural deficit, and so on. Please. And here's how it's done, of course. As mentioned, about half cuts and half tax extensions to fill that, to address that imbalance. The governor, I think, reflecting public values, said we should protect education and public safety when we prioritize about spending limited resources. And then along with that are some restructuring ideas to transfer money and responsibility for programs to local agencies and do something for a longer time. Budget for more than 6 months or 1 year. Let's keep going. Here's the numbers that go with that. It's simply summarized as half cuts, half taxes. One of the debates that goes on, Republicans will say, well, these aren't really cuts because you're taking money out of the mental health fund, or you're taking money out of First Five and tobacco and moving it to other mental health or other expenditures. And while that's true for a few billion for the programs that lost the money, it's really a cut. So there are cuts in a variety of ways that are part of this plan that get it to the basically 50-50. Keep going, please. Here are the dollars associated with those. A few of these things were changed modestly during the budget adoption process. About 250 to 300 million in proposed cuts in health and human services. The legislature chose to make some modest changes in some of the accounts, basically getting to pretty much the same dollar amount of savings, but sort of saying, well, let's take it from here rather than there, and some programs internally that maybe Deanna will want to talk about that they tried to rescue a little bit. Please. In terms of realignment, this is still an active discussion, so there's not a lot to talk about here other than that there's been work on these areas for a number of years. The basic idea is that frequently local governments are able to provide similar services like prisons or whatever at a more efficient, more cost-effective basis than the state does. And so if our partnership with locals, and this is principally state and counties more than state and cities, but if there's some shifting like that can occur along with revenues that help them pay for that responsibility, that's a smart thing to try to do to return programs to local purview. The worry always from locals is, well, are you shifting enough money to really make it work? And that's a fair question, and I think people have tried to do that honestly. And then secondly, well, what about you're only doing it for 5 years? Well, the point about that, of course, is this is a 5-year plan. Everybody is at risk 5 years from now. The taxes go away 5 years from now. So similarly, the local money, which would come out of the expiring taxes, go away 5 years from now. So everybody's at risk if this were the plan 5 years from now. And they would dedicate some sales and VLF money to see that the program transfers were paid for. There's a lot of debate about various parts of this, particularly with respect to incarceration policies and shifting prisoners, and so that's an ongoing discussion. Please, next one. The redevelopment issue, I assume there will be some people that want to talk about this when we get to Q&A, but I will simply mention this was most legislators didn't view this with like heightened enthusiasm. It was and they don't argue about the success of numerous redevelopment issues or programs around the state. I think everybody recognizes the value of those economic strategies in many instances. There are legitimate criticisms of redevelopment agency spending and programs and politics. Those could, in a normal circumstance, those could be corrected by reforms. The legislature was constrained because the only options available because of the passage of Proposition 22 last year, principally financed and written and sponsored by redevelopment agencies and the cottage industry that exists around them. Because of 22, the only choice you had was eliminate them or leave them alone. Reforms are not allowed under Prop 22. So they didn't have much choice, first of all. And secondly, what they thought was a higher priority was K-12 schools. And so one of the issues that everybody has to answer, because everyone says, well, wait a minute, my spending for whatever is important, okay. Everybody says, don't cut me, cut someone else, don't tax me, tax someone else, etc., is okay, what is a lower priority? If you want to find a couple of $2 billion more for public schools, where do you get it? And how do you do it? And so that's the debate, and that's the policy choice that was recommended. Simply, it's a higher priority. to put money into schools, and that's what the budget reflects. Keep going, please. We'll come back to this, I'm sure. Most of the cuts that have been adopted were in higher education, social services, and criminal justice system. And that's the $11.5 billion so far that the governor has signed, and there's more sort of sitting on his desk or in the legislature in various places to do additional cuts if there's more needed. The revenue proposals that from redevelopment, enterprise zones, and so on have not advanced. What do we have next? Next chart. Is there another one? Okay. Well, briefly, let me mention on the redevelopment issue, because I know it's the one, I've done a number of these discussions around the state, and it's the one that local people generally are the most anxious about, and certainly understandably so. The statewide pass-through, that is I think people understand redevelopment, but essentially a zone is created to address economic development and blight in an area, and then future tax revenue growth in that zone that would maybe otherwise have gone to the county, would have gone to the school system and the city, is scooped up by the redevelopment agency to make investments, economic investments in that zone. Some of the money gets sent through, and that's just increased over the last several years. How much gets transferred through to the other agencies that lost money? The statewide average is 17% pass-through. That Santa Clara County happens to be significantly lower than that. That is, the RDA agencies have a bigger take in this county than they do in most parts of the state of California. Keep going, if you would. We had to try to do some assessment, and I don't want to spend a lot of time on this because I think the data is inadequate, but the redevelopment agencies and local entities submit reports to the state of how much business activity was generated because of RDA investments. And unfortunately, I think they filled out these reports, as is often the case, somewhat casually. And as a consequence, what the numbers that we get say is they spent $1 million to create each job. $1 million a job is a really inefficient way to create jobs, if that's the real number. But anyhow, let's keep going. It's their filing, by the way, not ours. So the Santa Clara numbers I had mentioned, it's almost 10% higher that the redevelopment entities take compared to the statewide average. Now, there are some counties that are even higher than that. That the redevelopment monies, local property taxes, are diverted in much more substantially. Keep going, if you will. Keep going. It's the local numbers on rehab. I should mention, I guess, charts that aren't included here. One of the questions I asked is, well, how much, we worry a lot about national debt, state debt. The state debt is about 6% of our general fund is debt payments. Redevelopment agencies' debt is 37% of the money that goes through. Basically, they're debt machines. Now, I understand the reason for that, but in a society that's worrying about how much debt do you have and how much gets voted on by somebody somewhere, this is 30% of the money that goes through that's debt, and it's not voted on basically by anybody. Now, the second number. How much commercial construction goes on in the state of California that somehow the market magic got done without the investment of public subsidies? The answer to that question for the last 10 years, and it varies from area to area, but the statewide numbers are this. Redevelopment commercial development was responsible for 6.5%. 6.5% of the commercial development in California. Somehow or another, almost 94% of the stuff got built without a subsidy, which I think raises fair questions about its essentiality. Now, this is the final chart, I think, which is, okay, when do we grow our way out of this problem? And unfortunately, what we see is our business cycles get deeper. Climbing out of them takes longer. Every recent downturn has been deeper and longer. And so current consensus forecasts are that we return to pre-recession employment levels in the state of California in the third or fourth quarter of 2016. That's 5 years from now to get back to where we started. Now, hopefully that's pessimistic, but it is the current forecast of people who, even though economics is probably rightfully described as the dismal science, it's the one that most of them think is close to accurate for our state. Good news is the March revenue forecasts, or not forecasts, the money that came in during the month of March is somewhere between $1 and $2 billion higher than what was forecast. So that helps a little bit. I don't think we've announced that yet, but it'll be numbers out soon. Helps a little bit with the need to find another $13 billion or so to close this hole. But it, of course, is insufficient for our needs. At some point, I hope we'll get to the discussion of what happens, and maybe we'll wait on that a little bit, but what happens if we don't get this to the ballot and the voters don't decide? Mostly what happens, of course, just to oversummarize, is you take the list of cuts and you double them. Now, the governor did make a special effort to protect public safety and especially schools, or K-12 or K-14, well, K-12. Community college system takes a $400 million hit, and university and state college another $500 million each. You at least double those. Part of the problem is some of the things on the health and welfare side you can't cut. There are federal maintenance of effort requirements on funding and spending and other things that constrain that. K-12, the governor has over-appropriated. The way Prop 98 works in a downturn like this is the spending on schools is a function of how much revenue came in. So the governor has, because the formula allows for about $1.7 billion less than is proposed in the budget. That is, he's proposed spending more than the formula requires. Now, the formula drops, and so what the governor's really said is, let's keep them even. It's not new money, it's just not another cut, because K-12 has had a number of cuts the last several years. So he's saying keep them even. By majority vote, the legislature can cut that $1.7 billion or whatever that current number is. It's in that neighborhood. By the way, that's the $1.7 billion from redevelopment. So that $1.7 billion's gone if it doesn't come in from the redevelopment deal. After that, it takes a 2/3 vote to cut deeper into K-12 or K-14. In this environment where the Republicans are casting nothing but political votes, I don't think anyone sees an ability to convince some of them to vote to cut, to suspend 98, which some might think is good news in the school community, but I don't know how the budget works. So much of it is devoted to K-14, I don't know how you do a balanced budget without, if you have to do an all cuts budget, without figuring out how to cut more than the $1.7 billion. What that does mean, if you just took across the board 30%, that's sufficient. Just to give you an example, I don't know what every school district would have to do, how many can find reserves, how many can balloon up class sizes or whatever else could be done, but it's the equivalent of cutting 6 to 8 weeks out of the school year. What a terrible idea. A terrible idea. But it's the equivalent of doing that, a 30% cut in school funding. So that's the update, and thanks for the chance. I look forward to responding to your questions or comments a little bit later.
Thank you so much. It was very informative. And there will be time at the end for you to ask questions, and there will be no filters. We're not collecting cards and answering the questions we want to answer. We will have you stand up and ask your question, and we will deal with the questions. But you can certainly understand how we are faced with the worst of the worst. And I was reading at 6 o'clock this morning my April magazine, Money Magazine. I have 3 or 4 magazines I subscribe to in the financial area. And Carmen Reinhardt, an economist with a nonpartisan think tank, basically said that it would be 2015, 2016 before things really at least get back to where they were. So thank you, Bill. Appreciate it. And next we have Secretary Dooley.
Thank you, Senator, and thank you, Bill. I have known Bill Lockyer for very many years and respect his commitment to public service, but I so appreciate his leadership as treasurer at this particular time. The experience that he brings and the clarity with which he describes the situation is extraordinarily important. When the Senator asked me to participate in this on this day, I so sincerely believed that we would be in phase 2 of our budget process, where we would be engaging local communities in the conversation around the need for continuing our current tax. Clearly, the situation that the Treasurer has laid out for us makes it even more clear the disappointment that we should all have that the public is not going to be engaged in the right conversation at the right time. Of the $12+ billion of cuts that we made over the last 3 months, almost $6 billion of it is in the agency that I began leading just 3 months ago. These are devastating cuts. They have significant consequences. And for the first several weeks, as we started through this process, and I engaged with many stakeholder groups, individuals from local communities, their representatives in Sacramento, and at first, as we invited people to talk about help us, we set out the best budget we could. The governor was very invested in this process, even during the campaign, laboring to know how he would propose to honestly and realistically solve the situation that he was going to inherit as he took office in January. And we engaged all during November and December to put those details together. And when they were announced in January, we began a very robust process of engaging the people affected by this budget to help us refine it, to make changes. And we did that concurrently with our process with the legislature. And the legislature, under the leadership of Senator Alquist and her colleagues in the Senate and and the Assembly, did their part to honestly look at this. And for the shocking numbers resulted at the beginning, everyone did sort of the cut equivalent to what Bill said about taxing someone else. People came in with proposals for how someone else's program could be more efficient, how we could, if you only did this to their program, you'd have enough money not to do that to mine. And as the legislative process proceeded with extraordinary discipline and seriousness, all of those constituencies were redirected back to the reality that these reductions were going to occur. And we have had some extraordinarily beneficial conversations with people that are honestly trying to make their programs more efficient and to do things in different ways. I'm here to tell you what you already know. We are not going to do more with less. We are going to do less with less. These are consequential cuts that are a permanent reset. In Medi-Cal alone, for example, there's $1.7 billion of cut. And as Bill pointed out, much of that is leaving federal money on the table, because when we make reductions in what the state can support, the federal government has a savings, and we are trying to work with them to capture some of those savings that are resulting from our reductions in other ways, but we can't get back to where we are. We're cutting programs that have 90-10 matches, so we don't even have the dime to put up to get 90 cents on the dollar. It's heartbreaking. People often ask, as you would expect in a new administration, oh, you must be so excited to be coming back to work for Governor Brown again. Well, excitement was not really one of the emotions I've had the opportunity to experience yet. It's been devastating. And I mean, there have been meetings that I have had with people that I have to turn away from because I can't hide the tears. I know what you're facing. I worked with the most seriously ill and injured children in this state for over 10 years, and I appreciate the hard work that is done on the ground every day. But these cuts are unavoidable. I'm leaving Monday night on a red-eye to go to Washington to meet for 4 days to try to make the cuts effective. For all the reasons that the treasurer pointed out, we are a partnership with the federal government, and they must agree to these reductions. They haven't in the past. Many of the reductions that got rolled over one budget year to the next was because the federal government refused to go along with these reductions. We are in partnership with them on something else that's really important to do in California, and that I want very much to be a leader on, and that's healthcare reform. Healthcare reform can't even get started until we get our current programs in place and balanced. And that's a great disappointment to this administration in Washington. So we are working cooperatively with them to have them do their part to make our budget solid as a foundation so that we can go forward in healthcare reform. The cuts, as were pointed out, are not just limited to health. They're limited to the social services. And I could go through in chapter and verse with you the effect of these reductions. We're eliminating vision care for children. I mean, it truly is beyond our ability to understand the consequences of this. The developmental services budget, as Bill's slides pointed out, was proposed at $750 million. We've brought that down through our coordination and cooperation with the legislature to about $500 million, but that's still a huge number in programs that have been taking reductions over the last several years. So there are many frustrations in dealing with the current circumstance, but the greatest for me is to have the partisan character of this overshadow the policy that many of our partners, and I've been a lifelong Democrat, but I left Sacramento at the end of the governor's first 2 terms of office and moved to Tulare County, one of the most conservative areas of the state of California, and I've often joked that being a Democrat in Tulare County is like doing missionary work. But I did that work for 30 years and worked alongside Connie Conway, who is the leader in the Assembly, and she is a good woman, and she cares deeply about these programs, and that the immense frustration that I have and that I share with you is that we can't break through for the good of California. And many of these reductions they oppose as well. There is nothing in me that believes that they can come back and make an all-cuts budget. And the truth is, I don't have a plan B in Health and Human Services. It was all we could do to get to the nearly $6 billion of reductions that we did in January. And it is going to be very hard for us to go back and take very much more, if any, out of this budget. So that means that the education and the criminal justice system and the higher education are going to be ever more vulnerable. So somewhere in this process, and it involves all of you, we have got to come together and say, we have to fix this in a way that makes sense in the long term. Realignment, there are two things I want to share, and then one of the reasons that I appreciated this invitation, and I get out when I can, although we've been locked in Sacramento for weeks on end, is the opportunity to engage with you. So the most important part of my participation here with you today is to hear from you. I don't think I have much that I can tell you that you don't already know. This is a very sophisticated audience, and you've been following this for a very long time. But the two things I do want to speak about just for a moment are the realignment and the engagement with the body politic, which is what the governor's proposal for putting the vote to increase taxes to the people. It's only partly because that is there's a common belief that that is more politically possible if you don't make the tax extension yourself, but you let the voters decide. I think it's much more than that, and I've known this governor for a very long time, and at his heart, he is committed to partnership and personal responsibility. And his years in Oakland added to his philosophy and his commitment in government that there is very important work that goes on at the local level, and we need to engage the people at the local level as true partners. It underscores the need to take this to the voters, and it underscores his fundamental approach to realignment. There's much more about asking the voters to vote to extend their current taxes than just the revenue. It's about engaging the body politic in the kind of conversation that we're having here today about the consequences if they don't. It is very hard to pay attention to what goes on in Washington or Sacramento if you don't have any skin in the game. And it is very important to the success of our long-term health that people understand that there are things they need from their government. It has been sad to me to see for way too long that the notion that government isn't the solution, it's the problem, has become so accepted that we don't have the right level of respect for the programs. People need to understand what they're getting from their government, and this campaign around tax extensions is about making people understand what they're getting from the taxes that they pay. And I think that's an important conversation to have, and that we need to have it however this budget problem proceeds. The realignment is, I'm very committed to our part of realignment in whatever form it will take. And I think that there are a lot of advantages for local governments to continue the conversation that we've begun, even though the most important part for them is the constitutional amendment, which would guarantee the level of funding. But this has been a partnership that was pretty one way for a long time, with the state providing the money to the local governments after Proposition 13. When we look at that state general fund and the amount of it that goes to the local governments, Not in that chart is the property tax that is still at the local government. And prior to Prop 13, the local governments had a much greater opportunity to control their own destiny with their financing. So this effort to realign programs and put a funding stream that is predictable is a two-way street that I believe needs to go forward, and we need to do our part to reach out to the local governments. But the local governments need to reach out to the state as well and recognize that they're going to have a hole to fill whether we have a permanent guarantee or not. So we are engaging on the first phase of realignment is around public safety and behavioral health services. And much of the need to address the behavioral health, both mental health and substance abuse at the local level is related to public safety, because way too often unmet need in these areas leads to criminal behavior. The dependence on alcohol and substance isn't itself criminal, but it too often leads to criminal behavior, and we have to see the treatment of behavioral health needs as relating to public safety. So the first phase of our realignment proposal is to realign the programs to the local level, and we can get into more detail in the Q&A if you'd like, but some of the criminal justice services and some of the mental health and substance abuse services to the local level and put the funds with them. And the funds that would go are the funds that are proposed to be increased through the tax extension. The second part of our concept of realignment that would follow, and again, I hoped that we would be starting down that path by now, is the social services, CalWorks and CalFresh, which is our welfare and food stamps programs, would be refocused to the local level where the services are currently provided, and the funds would go with them. And the medical services, Medi-Cal and children's services, would come to the state in a state-administered program of healthcare financing and administration that would fit with healthcare reform and the development of exchange and the implementation of healthcare reform by 2014. I hope that we will be able to continue on that design and work with you and the legislators to make that possible, but nothing can go forward until we solve this. And I wish I had a silver bullet or an answer, or that any one of the three of us could have walked in here today and said there was a breakthrough last night, but it didn't break through, and we are going to have to roll our sleeves up and go back to the drawing board. But I can tell you that Governor Brown is committed to doing that, and he is not going to shirk away from this. He is frustrated. We are all frustrated, but we're going to spend a couple of days, lick our wounds, and come back and solve this problem with your help. So I would appreciate using the time, Senator, that we have to answer questions and engage in a dialogue. And I've got Mike Wilkening here as the Undersecretary for Budgets. He has knows a lot of the details that if you want to drill down further than I'm capable of answering now or after, we'd be happy to stay and answer your questions. But I really appreciate the opportunity to join you here today.
Thank you. A quick 4 or 5 points I'd like to make before we proceed with a most interesting part of the discussion. First, on a light note, I really want to thank my staff for coordinating the color of the microphones with our clothes. Gold, blue, and the orange to match your tie. Second, I see Sunnyvale Councilmember Otto Lee. Next point I wanted to make, I see Ms. Soto, Chief of Staff from Congresswoman Zolofgren's office. I'd also like to mention 2 other things. One, I've not talked about my legislation because it's so much more important to talk about this, but I authored several significant bills last year that have become law. One creates the health insurance exchange, which will be the first in the nation to do it this way. And the second that became law was people will not be able to be turned away for insurance for pre-existing conditions, for diabetes or cancer, heart disease, asthma. So I think those are really important. Now we need to have some funds also, to pay for some of this. And the last point, I really should have mentioned the governor. I think that Governor Brown has been extraordinary in really trying to resolve this issue. He has dropped by our caucus meetings several times. He spoke at the Senate Republican caucus. He's spoken with the Assembly. Tried really, really hard to get some Republican support for the budget. That has not been the case so far, but being the optimist I was, I did a little video yesterday morning on the great hope that all of a sudden I would be called in to floor session today to vote on a budget, but of course it's just dead. It's just not going anywhere. And my last comment is, as someone who previously chaired Sub 3 Health and Human Services, and back then it was called Health, Human Services, and Labor, and still a member of that subcommittee. I sat through at least 12 or 13 hours of hearings. And although I have never, ever cried over anything political in my life, I've only really cried when family members have died. It was very hard to sit in Sub 3 and, as an example, to have someone from the city of Santa Clara in a wheelchair who had worked hard all her life, was disabled. A lot of these services were going to be cut off, and she sat with the microphone crying for 5 minutes. It was all I could do to maintain my composure. So this is really the worst of the worst. And it is going to be several years before things improve. And all of us, both personally and for the organizations we represent, really need to understand it's very different today than it's ever been in our lifetimes.